Hi, and welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. And on this episode, I am pleased to welcome Dr. Christiane Manzella, who is a senior psychologist at the Seleni Institute, and Dr. Babalola Janadu, who is a board-certified OBGYN with over a decade of experience in women's health. And today, we are talking about the experience of and impacts on patients who are receiving devastating news during the perinatal period. We're going to talk a little bit about what it's like for patients to be receiving this information from their healthcare providers about what's going on during their pregnancy. Also, some of the experience of the provider of what it's like to give that information and how sometimes giving that information is also impactful for them. And we'll hear quite a bit about how important it is to give bad information in careful and compassionate ways. Dr. Manzella works at the Seleni Institute, which is a nonprofit organization that provides comprehensive reproductive and maternal mental health services. She specializes in working with individuals navigating grief and bereavement, trauma, fertility challenges, miscarriage, late-term loss, stillbirth, termination for medical reasons, child loss, and life transitions. She is purposeful and caring as she helps those with whom she works clinically to recover and navigate the complexities of bereavement, trauma, and fertility challenges. Dr. Janadu, or Dr. J, or Femi as he also goes by, earned his medical degree from the New York College of Osteopathic Medicine and completed his residency at Jersey City Medical Center. Currently, he practices medicine in northern New Jersey, specializing in comprehensive obstetric and gynecological care. He is affiliated with Holy Name Hospital, Hackensack Meridian Health, and Atlantic Health Networks. Dr. Janadu has been featured on the Hot and Bothered podcast discussing the economic impact of women's health issues. He also serves on the board of Seleni, a nonprofit focused on maternal mental health care and clinical education, and the New Jersey Partnership for Maternal Health. His dedication to patient care and medical education highlights his commitment to advancing women's health. I'm very glad to welcome them on, and let's dive into this conversation. Welcome, Christiane and Femi. Thank you so much for being with us today.
Thank you for having us.
Thanks for having us.
I'm really excited to jump into this conversation with you because it's an important one and not one that we have enough, and that is how people are receiving bad news and the impacts, potential impacts on them. This happens to a lot of people. People do get bad news in this kind of reproductive phase of life. We'd like to think that they don't, and it would be great if they didn't, but here we are. Life happens. So I'd love for you to share with us, just to frame our conversation today, what we're talking about from your perspectives, both as a psychologist and as an OB, and give us a little bit of glimpse into your perspectives on people receiving this kind of information.
I'll start with the person who is then coming to me after having received complicated bad news. And this encounter shapes often the rest of a person's reproductive life, the whole experience of being cared for or not cared for. It's just something that it becomes almost like a flash bulb memory of really wonderful care or really difficult and painful care. And so it's so important that we recognize that. It also that we deeply recognize the ways that it can influence the next steps in a person's life, reproductive life, any kind of bad news, that what are the next steps, so that this influences the trajectory of healing, of well-being. And so that's really, because we hear it over and over again. It was horrible that the person was so kind to me, or it was so horrible and the person just brushed me off and said, okay, don't worry, you're young, you can have another. So to really recognize the profound impact that hearing bad news and the way it's given has on individuals' lives.
Absolutely. Yeah. Thank you for that perspective. And Femi, from your perspective, I assume you're often having to give difficult information or bad news to people. What is your experience both with being the person who has to give that information and the impacts that can have on your patients?
Usually I am giving the kind of news that people love to hear, which is congratulations, you're pregnant, and the everyone is looking forward to this culmination and delivery and then the start of their lives, but it's often not like that. And I say that only to give the perspective of the highest high, which is we're
Mm,
pregnant and
mm,
we have all of a sudden we have these life plans to when the unfortunate event happens where either the pregnancy is not going to progress due to many different reasons, or patients that are looking forward to being pregnant and are having issues with becoming pregnant.
yeah.
And being with those families during those times is tough, both on me because I have to, or I'd like to try and understand their life perspective,
Mm,
their values, and both culturally, religious values,
sure.
and trying to understand how to deliver that kind of news to them in a way that is compassionate and takes them into consideration versus just delivering data to them.
Right.
I It can be tough on me, and as much I can't imagine from the patient's perspective seeing me giving them that news, but I really, because I care about the people that I see, it impacts me, and I think in the same way it impacts the patient because I care, and I think
Hmm.
that's
Hmm.
important for any clinician who's to folks and giving them news that's going to change their life, that they also understand the impact of how that news is delivered.
Sure. That can, if you're receiving devastating news, and as you were mentioning before, Christiane, in a way that feels curt or rushed or matter of fact, without like compassion or understanding the humanity there, it could really potentially leave a mark, and sometimes does contribute to
It
all kinds of
often,
things.
often leaves a mark. I heard somebody recently tell me that she was receiving terrible news that there had been a stillbirth. And she said that the doctor can't, it reminds me of what you were just saying, Femi, that the doctor really cared and said to her, I'm, I'm so sorry to have to tell you this really sad news. And then in the next follow-up visit, she said, I'm glad to meet you, but not in these circumstances. To really acknowledge again the reality of the circumstances which had brought them together. Same thing when people come to me, they say, oh, I'm so happy that we can work together, but I would rather have never had to meet you. And yes, it's just, and yet the recognition that that there's care there and
Right.
real care and a recognizing of the magnitude of what has just happened here.
Yeah, no doubt. I think, and I was just thinking as you were saying that, wondering what the difference is. Maybe, Femi, if you have, certainly sometimes people change their OBs when they've had a difficulty with one in the past. And if, who know, I'm not throwing anybody under the bus necessarily. Who knows why people communicate things in certain ways when they do, but I'm sure if somebody is transitioning their care to you and they're coming across a physician who's caring and compassionate, it does something for them. Have you experienced that?
Absolutely. I
Yeah.
have. People connect differently with different doctors.
Hmm.
Sometimes my style might not be the style that they are comfortable with
Hmm.
or like for whatever reason. And I think that's valuable to understand. And I don't find it to be off putting at all. I want to make sure that when I'm seeing patients that are coming, say, from another physician or
Hmm.
practice, that I understand the whys. And sometimes it's a painful memory. They don't want to be,
Mm.
that person represents a traumatic time in their life. And so they're like, I want to try and wipe the slate clean. Let me
Yeah.
go to a completely different, not scenario, but a completely different area,
Hmm.
office,
Hmm.
practitioner,
Oh, right.
hospital.
Right.
And so that I can just feel like this is a clean start. So I definitely have had that happen. And I've had patients transition to other practitioners for much of the same reason. And I think that that's a wonderful thing about having options
That's
in healthcare for patients to find the fit that fits them in that moment in time. Definitely.
yeah, yeah, definitely.
Oftentimes, the stairs going up into the office or the doors opening up into the old office just couldn't bear it. So what you're saying, Femi, is sometimes the whole scenario of just need a change, because often there's a lot of unresolved, whatever happened and why, whether the news was delivered in a compassionate, wise way or not, is the trust sometimes can be, will this happen again? Will this person be able to keep me safe? And so the idea of going back to the same place as before sometimes doesn't work, but sometimes, paradoxically, it can if
Mm,
there was a real trust that was established. And I remember you and I, Femi, talking about really wanting to make sure that the conversations that we have about delivering bad news also strengthen the healthcare system, because we want those with whom we work to trust that we're going to be able to take good care of them,
absolutely.
even in horrible events. So that's also something I think that can go both ways.
Definitely. Definitely. People establishing trust I think is the crux of delivering that kind of news in an effective way instead of breeding distrust based on how that news was given. I've been in situations where the patients didn't believe what I said, and I don't know that I don't think that it was because of the way I gave the news. It's unbelievable to them.
Right.
Sometimes this is the first time I'm meeting them, because of certain scenarios at work where, say, I'm covering the whole hospital as the in-house OB. I meet people for the first time, and all I have is a set of lab results to go on and a short bio. And at that point, I have to come in and quickly establish some type of rapport with the patient. And what Christiane was saying is so true. When someone acknowledges the fact that this is not the scenario that they would like to be in, say, I'm so sorry that this happened. I'm sorry that we have to meet like this, but I have some things that we need to talk about. And from there, hopefully the conversation will go in a way that the patient understands that I want to be there for them, as opposed to I'm just here to let you know what's going on, and then here's your options and you let me know.
That's such a challenging scenario for everybody involved. I mean, it's quite a bit of pressure all around, too. And it makes me wonder, I don't know how much medical training has shifted and changed over the years. It seems to be that there's more and more, from the outside perspective, not being a physician, it seems to be that there's more emphasis on, I guess, bedside manner. I don't know if that's the right phrasing,
Absolutely.
because I don't know how much really that was considered years ago, like how you relay information to people. Maybe it was just more medical, but bringing the humanity, the compassion into it things seem to be moving in that direction. Was that accurate?
They should. That is accurate. There are there has been a definite shift in how hospital systems, and not even just hospital systems, much more specific, physicians and their collective practices have emphasized the hospitality aspect of patient care as opposed to just delivering data and talking about treatments and things that are very hard hitting in terms of the nuts and bolts of medical care. And we realize that mental health is healthcare. And so
Great. Yay.
preserving that,
Good.
understanding that and
Right.
being in tune with that is a lot of the treatment, and the rest of prescribing or laying out evaluations, that studies that we would need to lab work and things like that are important, but addressing the patient's mental state and really caring for that and talking to the people that are of the appropriate skill level to address that is as important as the nuts and bolts of delivering healthcare.
Sure, sure.
That is healthcare.
Yeah,
It is healthcare.
yeah.
Exactly.
Just like you
Yeah.
said.
Yeah, absolutely. And Christiane, as a psychologist, you're deep in the trenches of understanding the emotional impacts of all kinds of experiences. But what have you seen from people, like some, not necessarily specific examples, but what have you seen are the impacts of on people of maybe even longer term impacts of receiving bad news in a difficult way?
It's emotional, it's cognitive, it's spiritual, it's a multifaceted kind of impact
Mm,
because how you think about things, how you feel about things is all interactive. What you believe about the meaning of life or the meaning of death or whatever has happened. And I'm using the D word, I know, death, but it is stillbirth,
Mhm.
whatever they experienced a death, a loss. And so what does it mean? So it's not it emotions are a huge part of it, yes, and thinking about it. So thinking about, did I do something wrong?
mm,
Even if one knows that there was a no nothing that the person did caused what happened, but there's often this horrible doubt that can, so unresolved grief and trauma can lead to a real reduction in the quality of life if unresolved. It's like an unresolved depression, like in postpartum depression and anxiety. When that's not resolved, it can clearly lead to a lowering of the quality of that person's life. It can become chronic. So what we also see is increased risk for anxiety or OCD or other kinds of anxiety related disorders because of this doubt, because of this fear, because of the, so oftentimes the work that I do in, and people who work with bereavement do is what I consider protective against developing the further complications, because a person who's experienced a loss is at risk of a postpartum anxiety or depressive
right.
episode. That's why I say it's emotional, it's cognitive, it's spiritual, it's the whole thing.
Sure.
Absolutely.
People are, have hopes going
Yes.
into a pregnancy and have sometimes gone out into the future with timelines and,
Yeah.
oh, if my baby is born at this date, then this is what's going to happen next. And receiving bad news, that all of that comes back into kind
It
of
cuts
question
it
and
off.
reflection.
Yeah.
It shatters that world that has been created
Mm,
based around your pregnancy and the event. But just I've seen so many patients have the plans all the way through college. My
mhm,
baby is going to be the
mm,
next president of the United States, and
mhm,
even for myself as a father, I had those same feelings about my own children as
sure.
soon as we knew that they were on the way. So it definitely is that it almost cuts that vision down in
Mm,
a way that is devastating.
And it's complicated too because the hopes and dreams are that hopes and dreams and images, but there is no long lived life of memories to draw upon. And
mm,
so, what you're really drawing upon is the hopes and dreams and memories of those hopes and dreams that are now shifted forever. And even in unwanted pregnancies, by the way,
mhm.
there can often be a real challenge about I didn't want this, so did I cause it? So there's another thought that comes up and can really complicate the next steps of recovery.
Yeah, that's also an interesting perspective. Sometimes bad news for that person could be that they are pregnant,
Very true.
and
Very
that
true.
that has its own set of complications, challenges potentially. So Femi, as a physician, you were just mentioning you have your own children, you've been through this process. What is it like to have your own kids or even be in the process of trying to have kids and having to deliver bad news to people when you've had your own or you're in your own process?
In a selfish way, it makes me more grateful
Mm,
because of the perspective that I
sure,
have.
sure.
It also saddens me
Mm,
when I have to give news about the patient's it's another cycle and they're not pregnant, or they're pregnant into their third trimester, and for some reason that I can't explain in the moment, there's a demise, or even earlier at any point. I understand that I am fortunate, and what I try to do is give that person my humanity as opposed to me being a physician. Because
okay.
at that
Yeah.
point, I can tell you what's going on.
Sure.
Sorry, go
Right,
ahead.
right. No, I'm yeah.
I can tell you what's going on all day, what's happening. But I think in that moment, what you need is somebody to reach across, to reach out to you in just a humanistic way, as opposed to, like I said, the veil of I'm a physician,
Mm,
I'm doing my job, here's what we're going to do. And I can be very coach like when I need to be,
sure.
right? But at the same time, I think when those things happen, and I think about my own scenario, and I think about being a fortunate person to have a family that was without major complication. I think at that point, it drives me to reach across that divide of
Mhm.
patient and practitioner and just say, listen, I feel for you. It's not just your scenario. I'm here sitting with you, and I want to be open to listening to you. We can
Right.
take all the time you need and let's talk about it. I'll give you explanation from a medical perspective, but just tell me if you want to scream, you want to shout, you want to cry, whatever you want to do. Let's talk. Let's do it. And I'm fortunate to work with some really great nurses and resident physicians that all feel the same way. And that's also helpful,
Oh,
you
for
know.
sure it is. I was thinking about the constraints on your time. There's all these other parts of the system that are at play,
Right.
like billing and appointment times and wait time and all of this other stuff that
Right.
I imagine at times you have to like really push all that out to the side to be present because those pressures are, I assume, constant. Like they're always there.
Yes. Always, always. But I think I think physicians, I would like to think that physicians aren't thinking about that in those moments, because when you're focused on something that is deserving that extra that extra touch, that extra effort, all the other things that are happening don't necessarily come to the forefront. The patient's in front of you, the
Yeah.
issue you both are looking at from different perspectives, and you really want to handle that. And the way I think about it is, if the next patient who's waiting on me, when I get in there, when my focus has turned to the next patient or the next issue, I'm going to give that patient or that issue my full attention and my
Hmm.
full amount of energy. And I think people appreciate that.
Yeah.
I'm sorry goes a long way. I'm
Hmm.
so sorry that you were waiting, or you, like I said, you give that humanity, I think, to everybody. Say, listen,
Right.
I'm here, I'm focused. Now let's talk about it. So it
You
does help.
know, another thing that you hinted at was your awareness of the good fortune in your life to, and I
Yeah.
have 15 pictures of your kids, they're adorable. And to recognize that, and I've had conversations with other providers who have said, oh, it is such a sad thing to, and these are conversations with many different providers who have had such a deep sadness around this, that they've had to be the deliverer
Hmm.
bad news. And also thinking, oh gosh, how can it be that I have such good fortune and in my life that I have this, and really being afraid of having a similar fate. And this is something that is not wouldn't, they don't share this with the person whom they're caring for, but this is their invisible work. It's like recognizing, whoa, I'm so sad for this person. And
Right.
I certainly hope that I can care for this person in a reasonable, excellent way. And how fortunate, I don't want to have a similar fate. And that's
Right.
really courageous to actually acknowledge, because
Mm.
it can really help be protective around one's own mental health as a provider.
Sure. Yeah, as you were talking about that, I was thinking there's all kinds of space for secondary trauma. Hearing traumatic things all the time, let alone being the deliverer of something that's potentially
Yeah.
traumatizing, has an impact for sure. And you could go many different ways with that. As let's say, if you're a burnt out provider, you might
Right.
you might tend towards the side of short, informational, or if you're in your own trauma, it might be hard to going through your own loss while having to tell somebody about a loss or a
Oh yeah.
complication can be really hard.
Yeah.
And right, there's all kinds of ways it can be complex.
That's very interesting. As you say that, I think about myself as a male OBGYN. I've never had the kind of connection to one's infertility that, or fertility, excuse me,
Mm-hmm.
as say my wife or my female colleagues, patient. I immediately think about my colleagues that are pregnant,
Mm-hmm.
showing, and they have to go give that kind of news to somebody that has lost a child, and what
It's really
kind of,
hard.
yeah, that is, I can't even imagine. Although I've seen this happen, okay,
Yeah, yeah.
but it really makes me reflect, even as you say, that there is that aspect that I can't necessarily fully understand, which I think is important because there's always the male counterpart in, not always, I won't say that. There is a male counterpart in these scenarios.
Mm-hmm.
Or
And
a partner.
right, the partner, absolutely. The partner is in this scenario as well, and putting, how do they feel about what their partner's going through.
Right.
And they are often thrown because they now my interaction with them is going to end, but their interaction is going to continue.
Mm-hmm. Mm-hmm.
And they're also important in that scenario. And I'll now talk about it from a male perspective. A lot of times in these scenarios, as a husband, as a partner, it how do you deal with now being in that scenario with the woman that you love and that you have this traumatic loss? And I think that there's not a lot of emphasis on that, because when they go home, there's going to be a lot of emotion, a lot of wondering, a lot of questions maybe that aren't answered, that I think is also not necessarily addressed like it should be. And I
Sure.
wonder, Christiane, do you see couples together, or do you mostly see the patient only?
I do a combination, because I think that often it's really helpful for a couple to come together to understand the really significant similarities and differences in each person's grief, because there are grief trajectories, but also, and it's not to be stereotypical, but it's a different form of loss
Mm-hmm.
for each person. And so to
Mm-hmm.
understand that sometimes some people are strategic and will say, okay, we're going to get this done, we're going to get it taken care of. Or
Yeah.
others are more emotionally based. And so
Mm-hmm.
to recognize their different styles, as it were, of grieving and handling trauma, and to recognize that there's no right or wrong way to quote grieve. And we just want to make sure
Mm,
the person doesn't get stuck in grief or trauma. And for a couple to open the conversation with each other of understanding that it's not my way or the highway. And
Right.
I'm
hmm.
saying that because oftentimes, no, he's not, he's too emotional and she's not crying enough. It's just like, in each
Right.
person's grief and trauma response is there are normative patterns. And so to actually help people recognize that, I like it when couples come to me because it helps open the door but understanding. So yes, I like to see couples. That was a long answer.
No, that was eye-opening for me, definitely.
Yeah.
That's, yeah, Christiane, I'm sure you've met with many people who have received bad news. What are some of the ways that you've heard that they would have liked to hear difficult news or an approach? Like from a patient perspective, what have you heard?
That the person, look at them eye to eye, that the person is sitting at the same level as they are, that the person takes their time, that they really convey that they are there to convey this really hard and difficult news, and that they're not in a big rush, that they lay out what it is that they know, and also leave time for questions and answers, and even if allow tears, allow for interruptions, and to, as okay, the time is marching on, tick tock, but to actually, in the sense that you are talking, the healthcare provider is talking to that person, and that they are the whole world right there.
Yeah.
That they really matter, and that they have been listened to and taken seriously. Good listening is also a huge part of this. So those are the little top points that I can think of that have made a huge difference in the lived quality of hearing this bad news.
Sure. And maybe conversely, maybe how do you support people who have received bad news in bad, difficult ways?
Yeah,
How do you help people cope with that?
let them, encourage them to talk about it, to process it, not to judge what actually happened. Oh, that person is so out of line or whatever, but to address what it is that the effect on them, and not to make excuses for what happened, but also to allow the person who received the bad news in such an unfortunate way to process it cognitively, emotionally, and to recognize, yes, that impacted you in a terrible way, and to honor the emotional truth of what happened in that moment. It was just like, it was awful. And I'm not judging the person who gave the news, I'm judging the way it was given. And I'm not saying judging as far as like,
Right, right.
judging.
Evaluating.
Acknowledge, yeah, that was really hard.
Yeah, that's really important.
Social media and Google, or however you want to describe it, because people often will go down the Google rabbit hole, and it can help and it can hurt, because when I worked with someone once who thought they were given a diagnosis. This is before reproductive of, I know I shouldn't talk too long, but just the idea of, and there were three options. One was like, it's not so minor. It's pretty minor. The second one was like, this is really serious and we can take care of it. The third option for the same illness was, yeah, you better get your will in order because you will die. And so,
wow.
Yeah. And this is, I know we don't need to say that, but it's just, yeah, it's not, social media and Dr. Google is not set up for us to be, it's not set up for individualized information. So it can be damaging in that way. It can be useful, but also without some kind of support along the way, and also getting records. You can look up your own records now and find what your diagnosis is before you even met with the clinician. I noticed now that many people say they notify the patient that your physician has not seen these results yet. Good, okay, good, fine, that's excellent. Wow. Because it reminds the person that, all right, you're seeing this, and you're going to go down the Google rabbit hole. And it's the only reason that I worry about Google is that it's a wonderful source of information, but it's not custom made for you, for the person to whom the news is being delivered. And social media also could be a big trap, compare and despair. She said this, he said that, they said this, they said that. It's just, oh my God, I'm not reading the right way. I should feel worse, I should feel better. And people can spend so much time distracted. It can be helpful and distracting. So that's my thought about social media, etc.
And I imagine that people come into you, Dr. J, and say that they've looked stuff up before you've even had a chance to have a chat with them. And of course, people can look things up. I'm not saying that they can't, but to your point, Christiane, you're gonna get a lot of information that's not tailored to you. And if you're getting bad news that's not, let's say, not necessarily demise or a loss and a death, but it's bad news like a medical condition, or it's bad news there's going to be something that your child will have to deal with, for sure you can get a lot of
Mhm.
information that might not apply to you. I'm like, Dr. J, how do you deal with that? People coming in with Google and social media info.
We listen, I may look young, but I have seen the technology increase in a way that we're the conversation that kind of floored me, and this is where I'm showing my age, is when someone much younger than I said, we're now at ChatGPT. We don't even Google anymore. We just go
Mhm.
straight to ChatGPT. And I said, oh my
Wow.
goodness,
Wow.
yeah,
Yeah.
I didn't even
Well,
think
that makes
about
me
that.
old too.
And this is what I'm saying. And so
Yeah,
we
yeah,
have
yeah.
that point where we're like, oh
Yeah.
wow, we're in a different time now. So
Mm-hmm.
it's interesting in that, and I will big up your podcast as well, because sources like yours really give people the right information. And to Christiane's point, when you just query the internet, you're going to get a whole lot of stuff that, even though your symptoms or your scenario might be a part of the answer, it's not anything specific to you. And that's why you need,
Really
it's
important.
best to have someone that is knowledgeable, help you tease apart the
Mhm.
nuance and help guide you to information, not necessarily giving you the answer, which some patients just want the answer. And that's fine. We can talk about that. But a lot of people need to, when I was in college, the PhD, the teachers, the doctors, right, used to laugh and say, "Doctor means teacher, not medicine. It
Mm-hmm.
means teacher." And they used to, because they knew I wanted to go to med school, and they used to just get out. And I'm like, in a way, it's true.
Mm-hmm.
We
Mm-hmm.
all
Mm-hmm.
teach patients, we teach people, whether we're in our practice or whether we're not. And so I think that when someone comes to me with an internet search and they're like, I'm convinced I'm going to die.
Oh,
This
sure.
is it for me.
Well,
I got to get my will in order.
mm-hmm.
And let's talk about, what did you read? Let's talk about it. As opposed to
Mm-hmm.
saying, that's not true. You shouldn't, don't think about it. Why'd you even look at the, I see that you want to have more information. I want to help you shape that information so that you can understand how it applies to you. And again, building trust. I'm not just telling you, and who am I? Yeah, I got degrees, I have things on my wall, great. But that doesn't mean you trust me. And I think a better method is to actually, and we're going to have to, embrace this reality as opposed to trying to maintain this authority above the information that's out there.
That can swell
Sometimes,
people's desire to look and to find answers that
sure.
we've been told,
Absolutely.
that whether it's ChatGPT, AI, whatever it might be, and I'm sure that there will be more that will evolve in the years to come. But to recognize that human intelligence and human wisdom and compassion is what will help shape and guide the understanding of what is actually being told here in a way
Right.
that actually applies to the person. So that's my hope, that
Oh,
there
sure.
that it can be used in a smart way to support rather than terrify.
No doubt. I agree with you 100%, Christiane. There, it is a challenging because sometimes, also, I'll just throw this in there. Sometimes the AI or the social media or the internet or whatever is not giving the right info. It's misinformation. It's the wrong stuff. And then maybe you've had this experience, people coming in to therapy with some sort of like armchair social media therapist, psychologist, influencer person, whatever, coming and having claimed certain things, and then us as the healthcare professionals, providers, therapists are having to right the ship a little bit and give them information so that they're not going down those like scary rabbit holes.
Totally.
It's really challenging.
I definitely can attest to that.
Yeah. would like to add in as last thoughts or things you want to make sure people leave with?
I think that what I just said about really using social media to support in a smart way, that was, I wanted to make, I hope that I said it coherently enough, because
You
I think
did.
it embraces the fact that people are actually going to use these sources. And so let's support it in a way that's supportive and doesn't terrify.
Yeah.
I agree. I mean, I know that's I'm gonna mention your podcast again in that these are examples of places that you can get information that is of substance and is not just for clicks or likes or for that. Of course, and I think these types of outlets need to be amplified and they need to be shared in a way that gives people the right resources. We need to be as big a voice out there in the new landscape as opposed to sitting back and waiting for people to come to us and then be like, okay, now that you found me, no, let's go find those, let's reach out, let's be that, let's really control the good information so that we can show people that there is a source in their daily lives that they don't have time to seek out the right person that's right next, that may be far away from them or whatever. Let's be out there. Let's be a voice. Let's really use what our experience and what we've learned to reach out to folk. And like I said, this is one of those types of outlets. Same things like the social media for the company that partly helped put this together. Selene does a lot of the same thing.
Yeah, I was just
Outreach
going to say
through,
Selene.
yeah, through Instagram. And they do a wonderful job at promoting maternal mental health and just mental health issues in general. And it's another source. There are many sources out there. And I urge people to seek out sources like your podcast and Selene so that you can interact and with those kinds of entities that really do have a mission to help promote information that is of substance.
Absolutely.
And
Absolutely.
accurate.
Yeah.
And accurate.
I was gonna say,
Absolutely.
And substantive, and that is being given in a way to support. It's not that we're going to get rid of pain, but we're going to support the resolution of pain and trauma and grief, and to really support quality of life. And yes, I am very deeply honored to be part of Selene. And I think that the mission of Selene and other organizations that support maternal mental health is there. It's supporting the next generation, not just us, but the next generation as well. So this is a longitudinal kind of effect.
right. Absolutely. Yeah. Beautifully said. Thank you, Christiane, and thank you, Femi, for coming on, and thank you, Selene, for all the work that you do and for bringing us together today.
Awesome. Thanks for having me.
Thank you for having me and us.
To find more information about Selene, go to selene.org. They are also available on Instagram at selene.org. Please also find Dr. Janadu at creativetyde.com/Dr. Janadu, at LinkedIn, Babaloa Janadu DO, and on Instagram at Dr. Hustle. Please make sure to share this conversation with as many people as you can. Really hearing that these conversations are being had, that physicians and healthcare providers are thinking about this, and that the tide is turning, that we are doing better and more comprehensive care in medical care. There's still work to do, but definitely there are people who are thinking about this. There are mental health care providers who are really thinking about this. And the more we have these conversations, the more we discuss this, the more we get this information out there, the better off we will all be, both as patients and providers. If you haven't yet subscribed or followed the Mom and Mind podcast, please be sure to go and do that. And while you're at it, leave a star rating or a review so that people who come to find this podcast know what you think about it and can decide for themselves if it's a good fit for them. I'm so grateful you joined us today. Thank you for being here. Until next time.